important topic. And I request Dr. Manjri Ranade to start the topic. And then we'll have a discussion in the end.
Sure. Am I audible? My screen is visible, right?
Yeah.
Okay. So this is
So
Manjiri.
I can introduce Dr. Manjri.
Please.
She's the director of Palash Pain Palliative Care Center. She's a visiting consultant at Jupiter Hospital, Kaushalya Hospital, and Hiranandani Hospital. She's a GC member of IAPM. She's a past ISSP GC member. She's written chapters in various books, and she has an international and national publication. And she's a very renowned faculty in our ISSP groups. Dr. Manjri, over to you.
Thank you, ma'am. Thanks for the kind introduction. So, without wasting time, let's go to the uh, topic. I just to share icon. Yeah. I think I'll stop sharing and again start because my slides are not moving. Just a minute. Yeah, it's visible. Yeah. Hello.
Mm,
Hello.
not visible.
Not visible. Okay.
You can share whole computer screen so that
Yeah, I'll do that. Radiation safety. Screen sharing is ready to start. There's some problem with screen sharing.
Yeah, it's not starting yet.
Yeah, just a second.
you can now open the
Yeah,
your
I'll do that.
you can see the zoom there.
Yeah. I think now it should be possible, visible.
Yes.
Yeah.
You can start.
Yeah, now we can
So
see.
sorry. Yeah, I'm so sorry for this. So let's go to the topic of radiation safety. As ma'am said, this is a very important topic. Uh, from a personal safety point of view and also from an exam point of view, both the things, it is very important topic. So what is radiation? Just few slides of initial slides of telling you what is radiation and what are we dealing with. So radiation is an energy transit in the form of high-speed particles or an electromagnetic waves. The types of radiation what we deal with is ionizing radiation. Most important are X-rays, what we are going to deal it with today. And the other form is non-ionizing radiations, mainly in the form of microwave, radio waves, and lasers. Now, when we are dealing with X-rays, that is an type of an ionizing radiations, there are other type of ionizing radiations, which are alpha particles, beta particles, and gamma rays. So they are used in the other modalities. X-rays are basically an electromagnetic radiating originating in the electron field of an atom. Just a definition of it. Today, when I'm presenting the slides to you, there are some phrases which are just for the definition purpose and they are slightly complicated. I'll try and make them easy for you. Now, this is a radiation unit which has been used to measure the radiations. There are two systems of units which are usually used for radioactivity and radiation dose. The older unit, which is most commonly used in US, are Curie, Rad, and Rem. And the international unit, or they are called as SI units, they are Becquerel, Gray, and Sieverts. These are nowadays more used internationally. What do you mean by Roentgen? It's a unique unit for measuring the amount of ionization in air, or it is an exposure due to gamma rays or an X-rays. The unit which is used for it is coulomb per kilogram. Now, this rad is a unit which is used which is called as radiation absorbed dose. This is a unit used to describe the amount of energy deposited per unit mass. Anybody wants to say anything?
Right.
Yeah. So it is a unit used to describe the amount of energy deposited per unit mass from radiation of any type in the medium. 100 rads is equal to 1 gray. So this, I have converted this rad into a more used terminology, which is internationally accepted. Now, REM is Roentgen equivalent band. This is unit used to measuring the human dose equivalent. In that international unit is sievert. So 100 rem is equal to 1 sievert. Now, some of the terminologies are used in when we talk about the radiations. They are mainly three, that is absorbed dose, equivalent dose, and effective dose. Now, what do you mean by absorbed dose? It is an energy deposited per unit mass in a given tissue, usually measured in joules per kg, or it is called as gray. Equivalent dose, it is an organ dose corrected by radiation factor, and it is calculated by multiplying the absorbed dose by radiation weighing factor, usually measured in sievert. Don't get scared by this slide. I'll make it simple for you. Effective dose, it's a combination of doses which causes the stochastic effect, again measured in sieverts. This depends on the average radiosensitivity of an organ to the exposure. So now all this, kehne ka chahte ho bhai? So let's see. Absorbed dose, it is an energy deposited in small amount of mass. This mass can be anything. It can be water, it can be air, or it can be an organ, that is a human tissue. It is usually measured in milligray, that is 1 to 1000 joules per kg. You don't have to remember this 1/100 per joules per kg. It is usually measured in milligray. What does it measure? So it measures the energy absorption rather than what is a biological damage which is caused by the radiation. Understood, all of you? Then we'll go ahead to equivalent dose. If anyone has any question regarding this, you can interrupt me and ask me by raising your hand or put in the chat box. Now, next is an equivalent dose. Now, this is a radiation protection quantity. This measures the biological damage to the tissue from the radiation we are giving the radiation, that is a C-arm radiation or an X-ray radiation. Usually it is measured in millisieverts or sieverts. Now, what do you mean by effective dose? Now, effective dose is a dose which is calculated to the whole body, and it is addition of all the equivalent doses to all the organs. Now, this is usually adjusted, like your eyes have different sensitivity, your thyroid gland has a different sensitivity. So all this is taken into consideration when you are calculating the effective dose. And this is measured in millisieverts. Now, 1 milligray is equivalent to 1 millisieverts. As we said initially, as the US system was there, it was measured as rad or REM. Now, how to convert milligray and R to millisieverts or a gray? So 10 milligray is equal to 1 rad and 10 millisieverts is equal to 1 rad. So when we come to the effective dose of a sensitivity of an organ in the further slides, you will understand why I have converted this over here. Now, what are the dose limiting recommendations? This is the whole body effective dose. Annual effective dose limit is 5 rad. That is 50 millisieverts. Now, this is for the workers, that is doctors, technicians, nurses, who are present around the radiation giving unit, that is CR. To the general population who get exposed to this radiation, Less frequently, the annual effective dose limit is 0.1 rem, that is 5 millisieverts, for a frequent exposures, or 0.5 rem, that is 25 millisieverts, for a infrequent exposures. Now, the same thing, individuals below 18, that is a pediatric age group, annual effective dose limit is 0.5 rem. Now, pregnant radiographs, when the pregnant lady is there, the dose should be limited to 0.05 rem for any 1 month and 0.5 rem for a gestation period. We should always wear a monitoring badge beneath the lead apron at the abdominal level for a pregnant lady to know how much radiation exposure she has been to. Now, the medical use of ionizing radiation, whether for diagnosis or a therapy, not only results in the radiation exposure to the patient, but of course, we all workers, radiographers, radiologists, doctors who are doing the procedures are going to get exposed to that. So all these people, therefore, subject to some degree of radiation hazard. And that's why the terminology of radiation protection has come into the picture. Now, what does a radiation protection say, or it does? So basically, it ensures that the doses received are as small as possible so that the consequent damage never constitute or a significant hazard to the health of irradiated person. Now, what are the ionizing radiation? What are the radiation hazards which are caused to us? What can be caused to us? They are basically divided into two types. They are the deterministic effects and stochastic effects. Now, what are the deterministic effect? That for this to occur, you don't have to reach any threshold. Any exposure can cause this. So a minimum threshold is sorry, I'm so sorry for this. Deterministic effect is a minimum threshold should be attained to cause the effect. This means, example, to include a cataract formation or a skin reddening, erythema, and sterility. This is also referred as a non-stochastic effect. And stochastic effects are the effects. They may potential to any amount of exposure that there is no threshold for a stochastic effect. This may include a genetic defects or a cancer. Now, radiation hazards to the fetus. So if a pregnant lady gets by accidentally or she has to undergo something, then the radiation risks are as follows. It totally depends on the exposure magnitude and the time of pregnancy where she has exposed to the radiation. The radiation risks are more significant during the early fetal life for the first 3 gestation period. The threshold of malformations are from 100 to 200 milligray. 100 are for the mental retardation. An exposure of 1 millisievert is safe to the fetus. That is a normal exposure from a background radiation. That if the pregnant lady by mistake not visit inside the room, but by chance nearby the room. A dose more than 1.1 sievert is considered to be the threshold beyond which an MTP should be considered. Now, before going to the exposure limit side, I just want to say here, I have not included, or I missed that actually, putting the pictures. But in the case of radiation hazards, the burning of the finger and the skins are very much there. And if you see the pictures, it is really scary. Those pictures are scary. So we should be limiting ourselves to the exposure. The cataract formation, autoimmune diseases are very common. As Madam initially, when we were talking, she said that this is the most important for protection of ourselves. This is very, very important. So what are the exposure limit for the whole body? Head and trunk, it is 5 rem, that is 50 millisieverts, total effective dose equivalent. For lens of an eye, it is 15 rem, that is 150 millisieverts per year. extremities, it is 50 REM per year, or skin, it is again 50 REM per year. Now, when we are doing the procedure, like we are calculating, this is effective dose which have been calculated. So one chest X-ray. A single chest X-ray is going to give you a 0.02 millisieverts. If you go for a spine X-ray, it is 0.4 millisieverts. Lumbar spine, it is 0.7 millisieverts. Pelvic, it is less, 0.07 millisieverts. Abdominal CT, it is 8 millisieverts. And see fluoroscopy, it is 1 millisieverts per minute. So remember how much time we are exposing ourselves when we are using C-arm, when we are pressing that fluoro button. Now, what are the goals of a radiation safety? So, of course, we have to eliminate both the deterministic effects and reduce the incidence of stochastic effects. Now, the most important terminology is ALARA, as low as reasonably achievable. Whenever you talk about radiation safety, ALARA is the terminology which is most commonly used. So the ALARA philosophy and the guidelines are what to help to keep the risk of radiation exposure very down. These are the limits established to ensure that the safety is maintained at the same time that the lower doses carry out the lower risk, and this concept helps to maintain the cost-effective safety. Now, why it is as reasonably achievable? Because when we are doing the procedure, we have to see the image also properly to do the procedure. Always keep the radiation exposure as low as reasonably possible. And what are the ways to do it? Mainly 3 ways: time, shielding, and distance. The most important thing, TDS. So, how to do that? Time. Exposure has to be kept as short as possible because it is directly proportional to the time. Whenever it is possible, take your foot off from the fluoro mode. Continuous shoots should be avoided as far as possible. Only when we are seeing a dye spread, that point we have to use a continuous fluoro. Otherwise, do not use a continuous fluoro. You should use a last image to as a reference, freeze the frame and use it. I know it is very difficult initially, but try and practice to have a 5 minutes timer so that your exposure is less. Always used pulsed fluoro than a continuous one. You have to use normal low dose mode fluoro on your C-arm whenever you are doing a fluoro. Now, distance. Time, it was directly proportional. With the distance, it is inversely proportional. So distance from the radiation source should be as far as away from the radiation source. So how you will do it? So these are the pictures which will show you. This is the point of source. When you go away from it, your radiation exposure is going to go down. So the basic rule, 6 feet away from an X-ray beam is the point where you should start doing your fluoro. So take your pedal 6 feet away from the machine when you are shooting. This is important even in an examination. Of course, your own safety, but even in the exam, when you're carrying out a live demonstration on the cadaveric workshop, this has been observed that how you are using a safety to the patient, that is to the cadaver as a patient there, and to yourself. So this is very important. You should go 6 feet behind and then only press the pedal. So this is a distance variation. As we say in Verse square law, you double the distance, it is 1/4 of the dose, remember. So this picture just shows that as you go away from the radiation source, your scattered dose are also going to go low and your radiation exposure is going to go low. Now, shielding. So the most important here are the lead gowns. So this is a wrong lead gown. See, there is a gap in between. So that should not be there. So this is the proper way, or one gown, what usually is being given. Screen curtains has to be there. Now, what is the thickness of a lead aprons usually we use? Are 0.5 mm to 0.25 mm to 0.5 mm lead aprons are recommended. They should be hanged or kept on the horizontal position, not to be folded. Bismuth aprons are best, they are long lasting, but lead aprons are at least recommended. Thyroid collars, eyeglasses, and the best is wraparound aprons. Use shielded rooms which are AERB approved. I'll come to that again. And patient shielding, like for the eyes and gonads. The gonad shield is available. They are recommended while you are doing the procedures. So this is a gonad shielding. This must be 0.5 mm of lead, which is usually used. These are the radiation protecting gloves which are available. On this, they are of course not disposables. So if you want to use them, you have to wear a disposable or sterile gloves on them. Slightly they are cumbersome, but always recommended to use it. They are not must, but recommended in the use. Thyroid shield and gown, and if possible, a specs. They are must. So these are the protecting goggles. Now this is, all of us know, this is a Siam. So I'll just summarize them. This is your X-ray generating tube, X-ray generator here. This is tube. Then there is a collimation up. This is your C-arm, which is there. This is the portion where you have all your controls. Then this is going to be an image intensifier. There is a camera there, and this gets related to your monitor. So this is just some of the things. The patient is going to lie down over here. Okay. Now, whenever an X-ray tube is generating some photons, around 1000, out of that, reaching the patient, they are scattered. Only 20 will reach to the image detector. Rest all are going to be scattered and absorbed too. So this is equivalent, the absorbed dose. If you remember the terminology is what we have seen in initial slides. So they are equivalent to the radiation dose. So the scattered dose is mainly directed towards from the source. Now, the main source of radiation for the staff from the fluoroscopy room is the patient himself. From the patient, even the scattered dose is going to be there. The scattered radiation is never uniform around the patient, and we don't know how to calculate it. It's very difficult and complex to calculate it. So we have to have the safety. Now, these are some of the pictures which I got it from some of the from the net and from some of the presentations. So if you see over here, this is an X-ray tube which is shown, and this is an intensifier, image intensifier. This is a patient. So this is the most dangerous thing what you will do to yourself, to harm yourself. This is whole red and orange is bad. So as a distance increases, you're going to be safe. But anyways, putting this up is very bad. So this position should never be there when you're doing a procedure. We have taken an X-ray tube under the table. This is what is been taught to us always. This is your image intensifier. Again, this portion, your thyroid, your eyes, your upper trunk is safe. But what about your gonads? Even if you're wearing a lead apron, still you are in the danger zone. So go behind. 6 feet away is always 6 feet, like small steps. Feet, not 6 feet. It is 6 steps. I'm sorry. 6 feet in the sense 6 steps away from the radiation source. Now, next picture we will see. So what has been added over here? Just the guarding. A small guarding, screen guarding. this becomes slightly safer than the previous one. You're understanding what I'm saying? Again, this is 6 steps away, more achievable, safer zone. Now, again, an important one. When X-ray tube is next to you and when you are doing a lateral rotation of your C-arm, you are in a danger zone. So again, 6 steps behind, you will be slightly in a better zone. Another picture, when the X-ray tube is in front of you when you are doing a procedure, you have to ask your technician to move away, and you are also again in the safer zone. So most ideal is this position, but if not, if you have to go to this position when you are doing the procedure, then you should go away from the radiation dose when you are shooting the image. Now, angle. The radiation doses also vary from the angle at which you are shooting. So when this is important, when we are tilting to make our vertebra straight. So when you are doing, so say this is the patient thickness is, we have taken it around 18 centimeters, so mid around 70 kg of the patient. This is kV is 100, so this is maximum kV what we are shooting, and at a low MA, that is 1 MA. So when you are giving this angle is less, this angle is more, and this angle is more. So when you're tilting, your caudal teeth or a cranial teeth is going to increase your exposure. So you should remember that. So this thicker tissue masses absorb more radiation. Thus much more radiation must be used when steep beam angles are employed. So when you are frankly doing a procedure and the low vertebrae of L5S1, you have to really do a angle. It is quite steep angle. So you have to take the other precautions to protect yourself. Now, again, the field size, what you're shooting, that also the exposure depends on that is a scattered dose are going to be more when the field size is more. So that's why we have introduced a collimation in there. So what is collimation? This is a process by which the beam of radiant electromagnetic energy is lined up to minimize your this. So this is an open beam and this is a collimated beam. So I think this picture itself is self-explanatory. That's lesser tissue is radiated over here, and here the more tissues are irradiated. So the scattered radiation from this will be more than this one. So collimation is again important. So this reduces the patient's total entrance to the skin exposure, reduces the scattered radiation, and also the contrast of the image is improved by the collimation. It is inbuilt in the CR. We don't have to work on that. Now, most important is the dosimeters. So ideally, we should have all these dosimeters, but if not, at least one batch we should put above the apron, not below the apron. Okay. Now, what are the golden rules what we should follow? Know where the scattered radiation is going to be highest and position yourself accordingly. Stay away from the primary beam, including hand. So take out your hand. Use your 10 centimeter extension when you are putting a dye and when you are doing a continuous fluoro. So these all are very important things. So your hands should not be. When you are putting your hands on the needle, you should not put your foot on the pedal. Or if you're asking your assistant to give an exposure, you should strictly warn them that when I will say shoot, you shoot. Otherwise, don't shoot. Keep your distance as far as practicable, that is 6 steps away. Never use magnification modes, but use collimated roll. Use higher KVP and low MAs wherever possible. Always wear protective aprons and radiation monitors. And as I said, time your study. I know it is very difficult in initial days to time it to 5 minutes timer or something, but make a practice of it so that you will finish it on time. Now, some of the pictorial things again. So this should never be there. Ask your assistant to go away. So this is a better practice. Always, always, always image intensifier should be up and X-ray tube should be below the table. Always use some of the guard when you are using the exposures. Now, these days, we always do some of the procedure in CT fluoroscope. That is DSA. Very good images are seen very good on that. So let's see how about that. So CT fluoroscopy, it is a reconstruction and display of CT images in real time. It is significant advancement of CT technology and guidance of an interventional procedures. Conventional CT may result in the long procedure times and increased exposure to the potential inaccuracies because it is a conventional CT. You have to come out, go back, and do all those things. Now, CT fluoroscopy, the exposures are magnitude of dose are dependent again on user and the scanning techniques. High patient exposure with the extensive fluoroscopic scanning and additional exposure from the spiral CT, that is about 5 to 6 scans if you take, it's a very much exposures. Now, conventional CT, the person has to be outside the scanner room. CT fluoroscopy, usually the person who is doing the procedure are inside the scanner rooms. Now, CT fluoroscopy versus the fluoroscopy. So, on normal mode and this, see the difference, how much it is. 0.15 milligarai, it is 2 to 5 milligarai per second. Now, CTF is the skin dose, what we are talking about. The complete comparable to 20 to 30 minutes of a fluoroscopy during the cardiac cath lab or the other interventional procedure. So cardiac cath lab is more radiation exposure than our fluoroscopy. Now, basic radiation safety, that is time distance shielding, is most important when if you are using a cardiac cath lab or a CT fluoroscopy. Proper training of technical factors like fluoro time, 5 minutes timer, patient and personal exposure levels should be kept in the mind. Medical physicist evaluation, radiation and monitoring is must. Communication with the physician,
Hello.
technologist, hello? Hello? Yeah. Communication, physician, technologist, physicist, other staff, regular in service should be more communicated and told them about the safety. So, now we are talking about the government regulations. Now we have a licensing board which is called as a AERB. Now this license is mandatory when you are using a SIAM. Have to apply when you are buying a SIAM for your practice. You have to apply on a online that is called as a e-LORA system, and from there AERB certification is must. The location where SIAM is used, that is inside the procedure room or in your operation theater, they must have approved radiation shielding, that is a 9-inch brick or a concrete brick. If it is there, then it is a 6 inches. A door should be lead in that. The door should have a lead sheet in that. A qualified RSO must be designated to oversee a radiation safety compliance. He will visit you before you are given a certificate from the AERB. Quality assurance testing is must of your SIAM every 2 years. You have to produce that certificate. All occupational workers must be having monitoring, which are called as a TLD badges, which are worn over the apron, and one has to be kept in the room, which is taken as a basic amount of radiations, what has been in the air or the exposure is. These batches are usually 3 monthly or 4 monthly sent to for the measurement of a radiation dose where you are exposed. So the company, your local company, which is there in your area, will ask to send those batches. They'll measure and they'll send you the report, how much exposure you have been. So if you are going to many centers, you carry your own personal batch, and everywhere you should use that batch so that you know how much exposed you are to all of the radiations. Protection devices like lead ground, thyroid shield, and glasses are must. Recommended are even the lead gloves. Now, let's conclude. The minimize exposure while maintaining the image quality. Specification of a fluoroscopy exposure is very important. Determine the dose to the critical organs and doses to the fetus are important. Determine levels of exposure to the personal by TLD batches. Safety regulatory requirements for minimizing the patient exposure. Monitor performance of imaging system over time and compare the systems. And this should be communicated to your staff so that they don't get exposed much. This is a reference and a very good paper from where I have taken the quite a bit of references. Thanks a lot for hearing to me. So I'm going to stop my sharing. Any questions, you can put it in the stop chat box or you can ask.
Somebody has raised the hand. I don't know who's
It was my hand only by mistake. Yeah.
Okay. So students, come up with anything. We
Ma'am,
can proceed.
ma'am, I would like to have your interpretation or your
I think
some
it's an
of the
excellently delivered lecture, and you have covered up everything in a very small time. But one thing I would like to add up, this is what I was taught by a radiology department, that when you want to do any procedure, drink a lot of water.
yeah,
They say drink a lot of water because these scatter ionizing radiations, they basically get absorbed at the level of water in your body, and if you are dehydrated, they are more concentrated and they damage your DNA more,
yes, ma'am.
or cell damages more. But
Yeah,
if you have taken a lot of water, they get diluted, so the effect on your own body is much less as compared to non
yes.
dehydrated body.
Yes. So this advice when you are going for a cadaveric workshop. So in cadaveric workshop for the whole day you are exposed to these radiations, the scattered radiation because there are 2-3 C-arms in one room. So having good hydration there and post your cadaveric workshop, vitamin C is the most important thing what you should consume. So having a
Yes.
good amount of proteins, good diet, hydrating yourself well, and your vitamin C post a pre-workshop, workshop day, and the next workshop. That is very good.
And second thing is, when you are actually doing any procedure, I think you must add on some tubing so that your hands are away from, while you're injecting a continuous delivery of a dye, your hands are much away from the CM.
Yes.
Otherwise, what happens when you are injecting, your hands are there, and it gets more radiation exposure. So if you are attached the tubing, the
Your
connecting
extension tubing, 10 centimeter
extension tubing,
extension tubing.
so the your exposure to hands is much less. And they
Yes.
say that even if there is a small room or there is not much space, just moving 1 or 2 steps back from the place where you are, like if you can move 6 steps, it's very good. Even if you are not able to move 6 steps, move few steps away from the CM while it is being exposed, if given a shot
Yeah.
shoot order. So you should move a few steps away from it. That's
There are someone has asked, ma'am, that which are the numeric values academic point of view. Basically, you don't have to from the exam point of view. If you are asking, I'll just stop the recording, ma'am, first, and then I'll answer that. So